Hello, I am Dr. Dinesh, consultant nephrologist practicing in Bangalore. So I will tell you what is permanent catheter. A permanent catheter is a vascular access, and we used to create a catheterization into an internal jugular vein or subclavian vein or in the femoral vein. So we create an AV access that is vascular access for hemodialysis through permanent catheter. So this permanent catheter is like a temporary catheter, but it's longer, lumen is big along with the cuff. There are 5 steps, easy steps. I will tell you how it has to be done. First, create an, say for example, I am giving you on the right internal jugular, I will create an AV fistula permanent catheter. First, I clean the right-sided neck as well as the chest. So I shave that patient, and after that I will create a sterile area using betadine. So once the patient is lying down, all this will be done. Later I use an ultrasound to see I locate the internal jugular vein, which will be just above the carotid artery. So I will give a local anesthesia and I will do a venotomy with a bigger needle, and then I'll put a guide wire. Okay, this is the first step. Second step, I create a tunnel. So I create from a venotomy site to the exit site, I'll create a tunnel. So usually it will be 8 to 9 centimeters. So I'll give an anesthesia from venotomy site to the exit site. Sorry, from venotomy site to the exit site, I create a tunnel, and just on the tip of the tunnel, I'll connect to the catheter and bring the catheter near the venotomy site. So once this is the second step. So I brought the catheter near the tip of the catheter on the venotomy site. So once I do that, I use a peel-off sheath along with the dilator and insert. First, I create a tissue dilator and dilate that venotomy site to the tip of the and then I use a peel-off sheath along with the dilator, and I'll put it inside and then remove the dilator along with the guide wire. So once I do that, the peel-off sheath suddenly blocks the blood oozing out, and then I use the tip of the catheter and push it inside so that the tip of the catheter goes into the right atrium. So once it is done, I will suture the venotomy site as well as the exit site. So this is how I do a procedure. So what are the complications of permanent cuffed dialysis catheter? The most common complication of permanent cuffed catheter is infection. So although there is a cuff which in the tunnel to prevent the infection chances are always there if it's not properly taken care. If the catheter is exposed to the air or frequent water comes and touches the catheter, the infection chances are more. So how to prevent it? Aseptic precautions has to be used during dialysis. Every time the tegaderm, it should be airtight so that water and air does not go inside. So you should patient hygiene is very important. This is how you take care of the dialysis catheter. Okay, next, what are the second common complications? Second common complication is bleeding. When you do a tunnel, there can be a bleed from that side. Okay, so make sure the patient don't overuse the heparin or don't overuse blood thinner. Okay, and properly the venotomy site as well as exit site has to be sutured. So what is the third complication is the clot. Okay, there can be a clot inside the catheter itself. So we usually put a blood thinner, antiplatelets, dual antiplatelets, or we can put on blood thinner like acetron. What is the fourth complication? The fourth complication is malposition. So the catheter can go to other places, like it can be displaced to the subclavian vein. So it has to be, how to prevent it? It has to be done under ultrasound guidance as well as under C-arm, under the imaging it has to be done. The sixth complication is there can be any organ injury, like there can be an injury to the lungs, can cause pneumothorax, or there can be injury to the blood vessels itself. So these are the few complications of permanent catheter insertion. Thank you. So what are the indications of permanent hemodialysis catheterization? I will give 5 indications. So one most important is a patient with the CKD who comes for first time. It's always preferable if the finance and the patient is okay with a permanent catheter and patient does not have an AV fistula or AV graft, then permanent catheterization is the first preference. Because the lumen is bigger, the flow is good, and there's a cuff, so always the infection chances are less. Second, there is a failure of AV graft or AV fistula is this indication for creation of permanent catheter, which will be staying for a longer period. Third, if the patient comfort, if the patient is not does not want to get pricked with the AV fistula or the AV graft, then permanent catheter is a solution. Fourth, if the patient has all the vascular access failure, then permanent catheter is the only solution for them. Fifth, if the patient is planned for a renal transplantation in a short period, then permanent catheter can bridge towards the transplant. So these are the few indications for permanent HD catheterization. Thank you.